Diabetic retinopathy refers to the specific changes that occur in an eye involving the retina, nerve and blood vessel structures. The retina is a specialized membrane that captures light and makes the picture. These are then transmitted to the brain through the optic nerve and are processed to actually help you see what you see. Diabetes affects the large and small blood vessels of the body, and it also directly affects the nerves. In the early stages of diabetic retinopathy, there may be very small dot hemorrhages on the retina surface or focal swellings called microaneurysms. So with advancing disease, the changes become more prominent. The hemorrhages increase in number and size. There are more advanced changes of the blood vessels where they become irregular and narrowed in places. The very fine blood vessels called capillaries can actually disappear, and this process is called ischemia. All of these changes result in the retina not receiving enough nutrients and oxygen. The most advanced stage of diabetic retinopathy is called proliferative retinopathy, where abnormal blood vessels grow. These are essentially counterproductive. Although they are trying to supply the eye with a better blood supply, they cause problems from bleeding, scarring, and a progressive type of retinal detachment called tractional detachment. Diabetic maculopathy is a different variant of diabetic eye disease. The macula is the very specific part of the retina that helps you see objects in fine detail when you want to recognize someone's faces. It undergoes the same changes to the blood vessels and the nerves, but it can also become swollen, what we call diabetic maculopathy or diabetic macular edema. When there is severe diabetic macular edema, you have difficulty reading objects clearly, and you may notice distortion where lines become irregular or curved. Diabetes also affects the eye in different ways, such as the early onset of cataracts. Patients with diabetes are at risk of developing glaucoma, and all of these will need to be assessed carefully at your consultation.